As physicians, and particularly infectious disease physicians, we do understand where the public is coming from, why they would have concerns and fears. It is impractical and probably impossible to get infection from a virus like Ebola while traveling in the same plane with the patient or in the public space with the patient because of the way the virus is transmitted. There are two reasons for that. One is the fact that this is not a very hardy virus, doesn't live outside the body under harsh environmental conditions very long. And second, because of the way it is transmitted, i.e. Being in contact with fluids from the patient like blood, like saliva, like stool. At this point, I wouldn't say public should be worried that it's coming here or it's going to come here because we know now it did come here, and therefore we are placing precautions and not letting it spread. The best way to protect yourself from getting Ebola or any other contagious agents onto you is to wash your hands as much as possible with soap and water, especially after any kind of contact with others, and that can include simple things like shaking hands. Essentially what they did was infection control in a generic sense, and they were able to get aid, get more commodities for infection control, which they used, and used obviously effectively. Panic and hysteria can only be combated by knowledge, facts, education, and disseminating those to public in a very, very friendly and understandable manner. All the hospitals, including hospitals locally, are essentially highlighting the significance of absolute infection control to the staff, and also the significance of asking travel history to any patient who comes into the facility. And employees have been given one-on-one training on infection control practices. They have in their hands and all over the hospital guidelines from CDC, which have been customized to the facility to follow if and when they do have a suspicion of Ebola coming into the hospital. Public can learn facts themselves and then spread the facts to others who may have wrong information.